So a question I get asked often is how long do I need to take hair loss medications such as Finasteride, Propecia or Dutasteride? The answer to this question is you do not have to take these medications for the rest of your life. That's a choice. But you do have to take them for the life of your hair. A lot of my patients get an excellent 10 years out of them, 20 years, sometimes the rest of their lives. The reality is the medication does not have to be taken for the rest of your life, but to maintain the native grafts, it is required, because you know what? Once you stop the medication, guess who's waiting for you at the door? It's Mother Nature. And she will continue the natural evolutionary trajectory of what's programmed for your hair until she's done. Now this may be that you're stable for many, many years and you simply lose some hair, gets very, very thin, and then you get another 10, 20 years of stability. But the reality is with this condition, I always preach there's two things that we must always remember with androgenetic hair loss, is that the condition is unpredictable and it is dynamic. So we must always bear this in mind, and the medication is really like taking out an insurance plan where we reduce the statistical variance of you losing more hair. We can't stop it, it's not a cure, but it can significantly improve the longevity of the native hair.